Hello, we've arrived on the NHS Enterprise. Our leader has sent us on a mission and she's also sent you a message.
NHS Earthlings, your mission is to boldly go where no pre-assessment has gone before.
And our mission is to tell you how we can future-proof the way that we prepare children coming in for hospital for procedures or for pre-op assessment. And we've got Connor here, who's the next patient, and he's just going to tell you a little bit about how he felt when he came into hospital.
So when I came into hospital, it was a very scary feeling, especially not actually knowing if I was going to have surgery or not. As soon as I came in, I was very nervous that night after being told that I was going to have surgery the next morning. I didn't know what was going to happen, and it was quite a nervous, I had butterflies in my stomach. But yeah, thank God that everything went out okay, and just sent just something that would help, that would actually be quite to help people over in the future.
Well said.
So we just want to talk a little bit about how we prepare children now, either for procedures or for coming into hospital for surgery. So we know that the research tells us already that preparing children and young adults really well for procedures helps reduce anxiety and pain and helps reduce the overall hospital stay. And we know from the children that come in, from the children that come into pre-op assessment, we do our own little survey. So I always ask the children when they come in before the preparation how they feel when they come in, and then after the preparation how they feel afterwards. And if there's not much movement, then we do a little bit of unpacking of that and then redo the assessment. So at the moment we use picture stories, which as you can see are pretty outdated. So we go through a series of how we're going to do a child's journey from when they come into hospital through to theatres. We also use role play, so we use doctor's kit is always really good. We've got an image of an MRI scanner to help children through that. And we also use the anatomy figures to help them understand what sort of surgery they have. But there are inevitably children that we find really difficult to reach, and children that lack concentration, children with learning disabilities, children with social language and communication problems, and children with autism as well. And we know that children, even other children, are really taken up by technology, and we feel like we need to move with them and go with them so that they understand what's going to happen to them. And actually using technology in the future and actually giving them that virtual experience can enhance the process of the preparation.
Now, we are passionate about helping our children and their parents, taking them through to surgery. We're currently using a little app called Little Journey, and it will take our children from the ages of 3 years to 12 through a virtual reality experience, and it is proving to be extremely popular. But we need to move in the future. Our future is our children, and our children these days use iPhones, iPads, technology and even virtual reality, and we in pre-assessment want to go ahead and take that to the next step. And how we can do that is the Americans have already done a survey saying that doing virtual reality before a child comes into theatre is very, very beneficial. So our future is our children, and we need to look after them because they will become adults. So an MRI is an extremely scary place, not just for children but for adults, and it's loudness, confined spaces. We need to provide every inpatient and outpatient in the hospital with the opportunity to explore the MRI department, and this we can do at pre-assessment for every child that is going to have an MRI. Now, virtual reality has the ability to help our mental health patients with apps that can help them with relaxation. So for the children, even with disabilities, they will be able to explore the environment that normally is not available to them. And they can learn when they're on the ward and explore. So all children have the right and the need to have preparation, whether it's a blood test, a cannula, a theatre prep for a CT or an MRI scan. So let's provide the children in Cornwall with the best possible care that we can, using the tools and the equipment that we have here, because these children are going to be adults in an adult world. Thank you.
Thank you.
Brilliant. Thank you very much indeed, all three of you. Thank you. Well done. Great work. Colleagues, questions?
So out of interest, what were you looking at there when you had the VR headset on?
Okay, so I was in the hospital and I was looking out the window and in the lobby section. It all felt like real and like I was there again. It was really good.
Okay.
Actually, yeah.
Okay. And what difference do you think it would have made had you had the opportunity to have used that or technology like that prior to coming into the experience you had that you described a moment ago?
I feel like it would have been much better. I would have been much more calm. I would have been better about the situation. Obviously, going in quite blind makes you very nervous and you don't actually know what's going to happen. And if you go in knowing what's going to happen and know what your surroundings are like, it's going to be much easier for you to cope with it.
Absolutely.
Great, thank
Well
you.
said. Adam?
Thank you for your presentation. Thank you for coming in, Connor. I've got a VR headset myself, and I think they are incredible. The options that we've got for them in the future is amazing, really. I just wondered what you think about how we can use VR headsets throughout the hospital in other ways, apart from just for children.
Well, I actually think we can use VR headsets in every department, really. Okay, we're child-based, but actually there's a lot of adults out there that would help as well, dementia patients that come in. But we need to be doing sections in the CT scanner, into ultrasounds, MRI, any area actually that can be daunting for any child or even any adult as well. And especially our children with disabilities. We see a lot of children on the ward with disabilities all the time, not just for a procedure, but it will help them to see the world in a completely different light and a world that they will thoroughly enjoy.
I just wondered in terms of, so I think the VR headsets could be used in operations where you need to stay awake.
Yeah,
Oh yeah, definitely.
But I just wondered whether you knew about any issues around infection control, or whether you've had those discussions around VR headsets in that environment.
Talking to other hospitals up and down the country who are already using them in surgeries like that, there are plastic membranes that can go over the actual piece that actually goes to your head, that they can be washed and cleaned afterwards or replaced. So they can be a disposable item if you need to.
And my question around the £2,750 is the amount that we've got here for that. That's for one headset, presumably.
No, it isn't. In actual fact, the breakdown is what we want to do some new pictures.
Right.
Because there are some of the very young children that are not able to use VR. So it's replacing these pictures. And it's preparing these books with the trust. The trust have agreed to put it together, and that they will They would fund us for that. So actually, we've already got a certain amount of equipment. So what we need is one iPad that all this, the Ocean 3D, can be shown. If not everybody likes VR, they don't always like it close to the head, but you can have it put on 2D format onto an iPad. And that you could give to a patient for them to explore with as well. We already have this company who have already commissioned and been doing some work for the trust already. Now, talking to them, the one area that we need, and we take these children to, is the anaesthetic room. Now, that is not on their tour. It's not there. But for £75, they have agreed that they will come in and just film the anaesthetic room, so that we can then add it to that area.
So where I was going with my question, I think you've got to is that idea that are there any other costs that are hidden in that this is dependent on? But it sounds as if that's everything you need.
Yeah, and then obviously the money is quoted from the company to actually go into the MRI and film the MRI department.
In that case, go on.
So how many headsets would we be buying?
Currently we have one which is completely cordless, which is Wi-Fi accessible, and then we also have 2 of these and the cardboard ones that come with the Little Journey app, and that can be done on an iPod, which we have already got purchased within the department, that can just slot into the front of those for the patients to see either Little Journey or to extend. So we've got more than one piece of equipment.
So one last question from Tom.
So I think this is fantastic. I completely buy into the concept of making the whole patient experience, particularly for children, a more comfortable, safe feeling environment. I think it's really powerful. It's absolutely part of our strategy with the New Women's and Children's Hospital as well. We should be thinking in this way. However, I'm not clear about the 2750 still. So in terms of what we're spending it on. So you've said one iPad, and you said we're going to commission Ocean 3D to film the anaesthetic room.
To film the anaesthetic room at £75 to add on to what's already the Trust have got, plus the 2,000 for the MRI tool.
Right, okay.
Because we haven't got anything. The only thing that we're using to prep children today is this model that we've got, which is really, really good and the children can play with. But it doesn't help, it doesn't give the older children the experience of actually going into that department. And the 3D tool will do that.
What we actually want to do with the MRI is give them the experience that we can actually get children through an MRI without having a general anaesthetic, which obviously saves the trust lots of money, and obviously better the child not having an anaesthetic. So that's what we're aiming for.
Okay. Good. I think we need to draw a line under that time-wise. Thank you very much indeed, all 3 of you. It was a great start. Thank you.
Thank you very much. Thank you. So how did that go? How do you feel now?
I think it was quite nerve-wracking actually, more so than I thought it was going to be, and actually kind of getting all your words out was
How were the dragons?
a bit of a challenge. Dragons are lovely.
Were they?
Yeah, they were very, very good and asked some really good questions. Most of the questions we thought about, I think.
Yes, we had thought about them. There were obviously things I'd missed out.
You've got a few I wish I'd said.
I wish I said and I think that everybody's going to be like that, but yes.
So how did you feel about it? How did it go?
I felt pretty good about it, considering I've done a lot of these before.
These are
Yes.
Right, yes, experienced member of the team.
I've been used to being put under a lot of pressure, considering I've done a lot of singing before and a lot of stuff like this as well. I felt a bit nervous, considering about all the questions I had to think about a lot as well. I didn't really think too far about it, but knowing that's all good and we could win or get the money, which is really helpful.
Excellent.
Thank you.